Welcome everyone to another interview with TechCon. We have Jason Scharf with us today. Jason, welcome to this interview of yours.
Thanks for having me.
Okay, I'm just going to give a quick introduction and then we'll just get into the questions. Jason has spent nearly 2 decades pursuing his life's mission of catalyzing innovation. As an early stage investor, he targets bio innovation tech stack and the business of health. He has held key leadership roles in strategy and market intelligence at industry pillars such as Illumina, BD, and Amgen. Through the Austin Next podcast and the Substack Ecosystem MetaCognition, he explores innovation, bio, health, tech ecosystems, Austin, and their convergence. Once again, welcome, and I'm just going to bring your set of questions. Okay. So for those of all those who are just joining and getting to know you, what is the problem that you're most focused on solving right now, and why is that important?
I think we're in a moment of healthcare, human health that is changing at an unprecedented scale. And the issue tends to be is that the underlying technologies, I don't care whether you're talking about AI, robotics, to the things in bio like cheap sequencing, we can easily read people's DNA, to amazing drugs like GLP-1, it is changing things to such a degree that it's breaking the current healthcare system. So a perfect example, there's a technology called CRISPR, which makes it very easy now to alter DNA. It's like essentially cut and paste, right? Before it was very difficult. And there is the first CRISPR based drug hit the market about 2-ish years ago, called Casivigi, and it essentially is a cure for sickle cell anemia. Since it came out at the end of 23, I gave a TEDx talk about this in May of 25. Only 50 people had gotten it. Now, a lot of people are like, well, this is out of millions who have sickle cell, right? And you see, like, okay, it's expensive, it's all this kind of stuff. Like, my biggest issue is we don't have a business model for cures. When you ask like the large companies, this came up from Vertex, but like whether it be Pfizer, Merck, or whoever, to create a business model around non-chronic disease, which is what they're great at. It's not a giant conspiracy theory. It's Clayton Christensen's innovator's dilemma. Everything is lined up to do these things this way, and to actually make a shift of that magnitude, it takes a spine of steel. We saw it in Intel
People
recently.
people values process. That's
Yeah, exactly. I mean, you saw it at Intel, right? They're like, we need to, the last CEO, not the current one, the one who just got fired about, 6 months ago or something, came in and said, we got to get back to building fabs. We have to, be both the design and the fabs, do this up. It's going to be painful. It's going to be expensive. And after, I think, 2 years, they fired him because it was painful and expensive. Okay, what do we, he kind of said that to go with, right? And so like we're seeing this now. And so with these technologies that are happening and changing what is possible now, the business models, the business of health has to change at the same time. And so that's kind of what I talk about. You said in the intro, like where I invest in the bio innovation tech stack and the business of health. We need both of these pillars at the same time to be innovating so that one can catch the other and there's a nice flywheel. Right? We saw it 20 years ago with cloud computing unlocked with SaaS. You saw about 10 years ago, starting with the defense tech industry, moving away from cost plus into these kind of neo primes and actually build first, then deploy. We're in that same moment of healthcare, and I'm trying to help catalyze that. That's a very long-winded answer.
okay. Okay, the next question. From your vantage point, investing in digital health and biotech companies, what is changing fastest in the space and that most people are still underestimating? And you may have already alluded to it in the last.
Yeah, I think the what's changing is just realizing what's not where the gaps are. So another example, this was about I think last year. There was baby KJ. This was a precision-based one-off cure for this baby that had some rare disease. Don't quote me on what the disease was. And it was heralded again using this kind of genomic technology. It was heralded all around the world. This amazing breakthrough, awesome. We have a manufacturing stack in bio that is set for millions of doses, not to create one. We have a clinical trial pathways that, again, are set to these broad scale, not precision. we've been talking about precision medicine, whether you talk about N of one or N of 10,000, like these small groups for such a long time. But it's not just the widget. It's not just the medical device. It's not just the drug that actually has to change. We don't have a regulatory path for these kind of things. Now, we're seeing a lot of this start to change. And like that's back to the why I think it's such an exciting time, because people are realizing it can't just be the pill, right? Like pill alone is not enough. And actually, what ends up happening, I think, with some of these changes is the value starts to move away from the drug device and diagnostic to those two stacks, to the tech stack and to the business of health itself. And so I think that creates a lot of opportunity, also creates a lot of creative destruction. I've said publicly before, you know, I don't know if some of these like pharmaceutical primes that are 100 plus years old, Pfizer, Merck, J&J, et cetera, survive, right? We might be, I think we're in the Kodak moment for these kind of companies. And Eli Lilly is doing some interesting things as they're printing more money than ever with, GLP-1s, but investing in changing shape, which may be interesting.
Okay, creative destruction. We're bringing Jupiter in too, and you think AI is going to cause that for these large companies? Like you're going off the question a bit, but
I love
the
rabbit holes.
values people, the regulations and the systems we do have set around this, and obviously for human safety reasons, does AI get to disrupt that too? Because I think that's
So,
the bottleneck, right? So
so yes, 100% on both ways. So one, I think it's the entire step, right? I think AI is one of those things that is coming kind of and converging into this moment. If you follow what the FDA is doing right now, they actually, if you want to be really depressed, there was a few years ago, there was a podcast by Vijay Pandey, who was the head of the Bio and Health Fund at A16Z, and Amy Abernathy, who she was the head of the FDA for a short period, and then this was after she'd left. And the entire thing was like, the FDA is not ready for AI, both internally, externally, the wave that's coming, it was like, oh, well, this is terrible, right? This current administration, the current FDA commissioner, and all of the people he's put in place is changing that. Right, they're bringing Gen AI. They have it within the agency to be able to better intake, so that they can do these things. If you think about, if we go from about 50 drugs a year being approved, and we want 1,000, like the FDA has to look completely different, right? It cannot be going this kind of, here's a thing, okay, you want to change the thing, start all the way over, right? And so, yeah, so AI, I think, is going to be core to this stack as well, both on the input side and on the regulatory side, to be able to understand it and use it. Look, FDA submissions are these gigantic, documents, all this data, but it's very known. Like it's a checklist, right? Here are all the things you have to put in. Well, if you have all the data, why isn't it one button? Like why we don't have an AI agent that says like build out the submission from everything that we've done? And I think we're heading towards that quickly. And then you have the
AI
AI.
will write the documents, AI will approve the documents,
Yeah,
and so
yeah, exactly. Which is where it's going. You have AI on the other side as well, and obviously, then, and I hate that. I always hate the term "human in the loop" because I think that's the wrong framing, because that means it's separate. But it's no, it's that we're making superpowered humans, right? And this AI that they're doing all the experimentation, they're doing all the things, then making the documentation go in. Then you're right. The AI then reads the document going in and makes you orchestrating these agents within the FDA to understand, probe questions you had before, checking out these different things. Maybe we'll have synthetic databases that they can actually run experiments that weren't actually run on data. See, like, okay, well, how well does this go, right? But we need more flexibility, right? The line I say a lot is, you hear this: we have to move slowly. Patients' lives are at stake. And I think it's completely wrong. Patients' lives are at stake. We have to move quickly. Every moment we're not doing something, people are dying, right? And there's a balance. I'm not for like don't do nothing, but like we have to be thinking differently.
yeah, I guess that one generalized statement can't justify it all. And towards your point, like AI creating better information for perhaps the human judgment layer, if you will, if not the human in the loop, that works very quickly through
Yeah,
the next part.
superpowered humans. That's the way to frame it. Yeah.
Superpowered humans. Where are you seeing the most hype in this space that isn't yet delivering real value? So the opposite of the last question, essentially.
Yeah, it's the I think it's this back to this falling on the vine, right? Like I think it's all the innovation and invention is real. There's very little, I think, in this space. It's like it's hyped and um it's not real technology. There are cases of like, look, the in the Alzheimer's space and the like, that there's been a lot of Everything from p hacking to straight up fraud. This is across the board. Like the replication crisis in general is due to a lot of that. That's actually one area I'm very concerned about. Is if we're training all of these AI agents and AI scientists on the corpus of literature, and a lot of it is crap for various reasons. And of course, you don't have the null set either. Like if I have a terrible result, I'm not going to publish it. So that's an area that I think has hype and actually scares me a little bit because I love the idea of AI, again, superpowered AI scientists, but if they're being trained on this kind of data that is faulty for a whole host of reasons, there's, there's some problem. And one of the actual reasons also is there may be areas that are just the Wild West. Like we did a 20-person study and we got this result. We did a 20-person study, we got the opposite result. So okay, I think we need a 100-person study. Like we're still early to be able to set in stone and say here it is, right? And it moves too slowly. You've heard the phrase, science moves at the speed of one funeral at a time. We got to move faster than that.
And so within what's changed with this AI thing, not AI thing, but a lot of the AI push,
Yeah.
what are now the key ingredients that allow the innovation ecosystem to thrive?
So when I think about innovation ecosystems, I think one of the core premise I put is I think there are first principles to innovation regions and ecosystems that are not thought about enough. Like the idea is like you can draw a straight line from Dutch fur trading to Wall Street in New York. Like the entire underlying principle of that was about how do you create markets and scale those markets and make them liquid. Like that's been the core of New York and its entire time, right? If you look at like the Bay Area, right? I always joke whenever I hear people say San Francisco, like San Francisco was part of the Silicon Valley for the last 15 years. Like it was the valley was San Jose and the peninsula before that. But that was always about how do we remove friction, right? Whether that be when they were first doing semiconductors to the internet to mobile to even the foundational models. And so understanding that first principle I think is what is going to help things thrive. And it drives me somewhat crazy when I hear I can't stand more than anything Silicon Hills, Silicon Beach, Silicon Slopes. Like, what are we doing here? Like, you're asking yourself to be a pale comparison. There's a really famous quote from Oscar Wilde. That's one of my favorite. When I learned about it, you probably heard it. Is imitation is the sincerest form of flattery. Do you know that's half the quote?
I
The
didn't
other
know.
half
What's the full code?
that mediocrity pays to greatness.
Okay.
It completely flips the quote. It's like if you're copying, it's because you're mediocre, right? And this is going to be a shock to everybody. Innovation ecosystems existed before Silicon Valley. Whether you had
Of
industrial
course.
Manchester, whether you had Renaissance Florence, 1950s Detroit, whatever, like these existed. Can you learn a lot from Silicon Valley and what they're doing? Absolutely. There are lessons to both take, both positive and negative, and the same as we kind of go back throughout history. And I think that understanding those lessons, understanding the uniqueness of your particular area, and then how that sectors is usually the way it kind of shows up. Like if you want to build foundational AI models, go to San Francisco. Like, why would you want to do that anywhere else? Unless you have a reason to say, I'm doing it very countercultural to the way that they're doing it there. So I do want to be outside the bubble. And that makes sense in that case. If you're building back to our point, this kind of here's the next 20% better stent, here's the next 30% better drug, go to Boston. That makes sense. They've got the capital stack to go like that. If you're like, hey, I need to build something that is completely different using a platform plus asset, needs an entirely new healthcare system. I tend to think that Austin works really well for that. But the point is like it's going to be somewhere different. And so when you understand that stack of first principles, founder, capital, idea, all that together, that's when generational change starts to happen.
Tell us more about this part. Like Austin is the best place for the future for this health innovation.
So it rhymes up because Austin is kind of turning into. I mean, there are two parts to it, right? I've used two different analogies. One is okay. So while I hate Silicon Hills, which is the name for Austin, and I will do everything in my power to kill that. I do think there are, as we said, I think there are positives to understanding other previous models. So using that mental model and those analogies, I think that Austin is it's modern Silicon Valley meets 1950s Detroit. So it's like, startups, digital scale, then industrial physical, and then 1920s Paris. So it's creative, intellectual, and countercultural. Right now, what is counterculture has changed over time. And so those are kind of the three things. And that the shorthand almost of that is it's atoms, bits, and intelligence. And it's that convergence, right? So if you're building the foundational AI model, go to San Francisco. If you're building robots or driverless cars that need like come to Austin, right? That where the digital meets the physical world, and you need that kind of scale and that kind of counterculturalness, that makes it Austin. So where our bio and health pillar fits into that is that same thing. Is like if you're doing something at the frontier that requires an entirely new system to kind of come around and fit in and building businesses, then it makes a lot of sense. If you're going the very traditional, I've got a better asset, and I'm not knocking this. This is just something I've got a better asset. I can get it through tech dev to point X, then Pfizer, Medtronic, or whoever buys it. Absolutely, there are places that you're going to thrive doing that.
Okay. Last question for the day. What's the one fun fact about you that isn't on your LinkedIn?
I am a huge sucker for those AI like prompts of, generate an image based off of everything you know about me, or come up with these are the rabbit holes I go down, right? So things. And so the funniest one was there was one that was a kind of a CIA style prompt that was going around of like, give me the threat assessments, all these kinds of things. And so I did it. And then I asked, I said, like, I flipped it and said, okay, give me my superpowers, but like, don't glaze me. Like, this is actually like the real thing that I needed to know, right? I wanted to understand. And and so around that same time, I was about to launch the Substack, and I hated the name, and I was stuck on like Innovation Next or something like nothing was happening like that. I get the result of this prompt, the superpower one. It says your superpower is ecosystem metacognition. I was like, oh, that's it. That's the name of the Substack right there.
Metacognition. Okay.
And so
I just learned that term recently from my therapist, but yeah.
So that was yeah. So as I said, I always like running with those, and they're fun. Like I spend too much time on them. Like on any AI, rabbit hole I end up going down. But then we learn new things, and who knows what happens next.
Oh, that's fun. Thank you so much for taking the time to do this interview.
Absolutely. Thanks for having me.